So, for today's podcast, Dr. Smith, Happy New Year. Welcome back. Thanks for
Happy New Year.
joining
Thank
us
you.
today. So, now that we're back in, I won't say second semester, that really doesn't pick up here for another week and a half or so, but we are back after winter break. We thought it'd be a great time to do just an update here with this podcast. So, let's dive in and talk about the most recent involving COVID-19. So, yesterday we found out that Vanderburgh County has now moved into the red. And so I think a question that may be on people's minds is how does that impact the schools, EVSC, here in Vanderburgh County? So I'll just turn that over to you.
Sure. First of all, it was not a surprise that we moved into red because we continue to monitor on a daily basis
Sure.
all of the data coming from the Indiana Department of Health and other sources. So we were not surprised, but frankly, it doesn't change anything for us. We continue to monitor a variety of sources from data. We also continue to have daily conversations with our health officials here in Vanderbilt County. Um, we continue to have the mitigation strategies in place in our schools: social distancing, masks, thorough, frequent hand washing, uh, and disinfecting surfaces. So, really, what has changed is that there is a greater density in Vanderbilt County as there is throughout the state, but our mitigation strategies are still very, very effective.
Well, we've made no secret of the fact that we feel like what allowed us throughout the entire first part of the year to maintain in person instruction was those COVID protocols that we really put in place all the way back at the beginning of the year.
Correct. And actually, since the designation came out for Vanderbilt County going into red, I've had three conversations with healthcare professionals in Vanderbilt County. They all continue to say, stay the course. You don't need to do anything different. Your schools, your staff, your students, your families have been very successful with the mitigation strategies that have been in place. So continue the course, continue to monitor, but keep kids in school because that is the safest place for students.
Sure. And, just as a leader, as the leader of the school system here, when you reflect back to the beginning of this pandemic all the way to last spring, do you want to just talk for a second about how important that's been to you, what it's meant to you to have that collaborative relationship with our local health and government leaders?
Oh, it's phenomenal because had we operated just upon opinion or emotion, we probably would not have put in place many of the things that we did. Um, but we're charged with making the best decisions possible based upon the evidence and the data that we have at hand. So that's why whenever we make decisions, we don't do them based upon what we think per se. We base those decisions based upon what we know from the experts. And things, you mentioned from the beginning of this, many things have changed. Originally we had um, a data dashboard that we constructed because there were no other guidance that we were receiving from healthcare
And I
professionals.
think that's going back to last
Oh my
summer.
goodness, that's
Yes.
going back to July,
Yes.
where we had different zones because we wanted the public to know that there was some guidance and something that we were going to follow in terms of data that we were going to use to make the decisions. Well, that is so far out of date. That data is not that we were using then in July to track COVID is not even in existence any longer. And I think further evidence of that is that the Indiana Department of Health even changed their guidance based upon the science and the research several months ago in terms of the different conditions and categories of levels within counties. Because at one point in time, when a county went red, then there was a stronger push to have virtual learning, at least for older students. Now that's not the guidance.
Really, it's been a learning process for everyone
Correct.
throughout this entire pandemic.
But unfortunately, I think that can cause some confusion too.
Sure.
So the guidance that we're following in terms of county conditions and red was released by the Indiana Department of Health on December the 15th. So less than a month ago. So if individuals are looking at a document that is 6, 7 months old, then there could be some additional confusion. But once again, in the three conversations that we've had since it was announced Vanderbilt County was red, all of our healthcare professionals say continue to stay the course, continue to stay in contact, and continue to monitor data, but do what you're doing.
A couple of things I think it might be helpful to point people at if they're interested in more information. The Indiana Department of Health has a wealth of information. It's almost
Yes.
overwhelming. I mean, you could spend a lot of time on that from the dashboards to the resources. Would encourage people to go to that as well. And then I don't know if you want to talk about this for a second, but this is certainly something anyone can look at, and that is Governor Eric Holcomb's Facebook page. If you go to that, he does a weekly update with Dr. Box from the Department of Health and others, and they share so much information. It was just yesterday. We certainly watch that every week, but you can go to the Facebook page and watch that at any time. You don't have to watch that live, but I know that's been a helpful resource for all of us.
Certainly is. I know that the Department of Health watches that, as do healthcare professionals. Of course, the Department of Health also has access to other streams of information, but I would definitely encourage the public to tune in to the governor's updates.
Okay. And I know we will continue to monitor all of the data, certainly the county data, but really I think it's important people understand we're looking at specific school data as well, school by school here in the EVSC, not just the overall county data.
Correct. We monitor that several times throughout the day, and if things change, then we will change. But right
Okay.
now, upon the evidence and the advice that we have, we're continuing to stay the course.
Okay. And once again, we appreciate everyone's efforts. I hope everyone had a nice break and we're able to recharge because just the amount of work and effort that all of our staff's putting in, our students have done a great job. We know that will continue. So we're looking forward to a great second half run to this school year. And if we know more information, we'll certainly share it.
That's correct.
Okay.
Thank you.
Thank you, Dr. Smith.